Hello, everyone, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria Stone-Ozbek, and tonight we have a very special guest. Tonight we have Miss Shannon Watson, who is a personal home administrator, and she is going to be defining personal home care and what it means for the future of our community. So without further ado, please join me in welcoming Miss Shannon Watson.
Hi, good evening. Thank you so much for having me.
Yes, thank you for joining us. I'm so excited to have you on the show tonight because there are so many people that have no idea about personal home care, what it is, what they need it for. So let's start off by telling the people a little bit about who you are and what you do.
Okay, so currently, again, my name is Shannon Watson. I am a personal care home administrator in Pennsylvania. Personal care homes allow a resident to be taken care of without as much restriction as a skilled nursing facility. Again, I've been an administrator now for about 7 years, and I share a campus with a skilled nursing facility and an assisted living community. So we will be considered a CCRC, which is a continuing care retirement community. And the 3 levels allow for a resident to grow within their care needs. Many times you have residents or you have older individuals or individuals with other various healthcare needs or mental health needs that aren't safe to be at home. And there are different levels to their safety aspects. Some people need help washing their clothes. Some people need help with medication management. Some need full-on care. And the 3 levels of care that are given at a CCRC allows a resident to maintain some type of independence as they phase out of being able to stay within their home. Within personal, like I said, assisted living, you'll be in your own apartment. You have access to 24-hour care if needed. You can maybe ring a buzzer. You can ring a bell and ask someone maybe to explain why you need to take this med. They can come in and help you with a meal because in your apartment, it's like an efficiency. So you have a stove, you have a refrigerator, you have all those things, but there's help if you need it, almost like concierge care. Within personal care, it's a little bit more structured. You have managed medication times. You have around the clock medical needs met for you through either nurses or personal care aides or medication technicians. You don't prepare your own meals. We organize all of your healthcare appointments. And we have a physician that actually comes in to see you. Now, if you are someone who has maybe seen the same doctor for 25 to 30 years, we allow you to keep that physician and we just help you to organize those appointments and set up transportation so you could see that person. If you're a veteran, we allow you to keep your veteran benefits or veterinary benefits, benefits, and you would go to the VA. And again, that's personal care, and I'll go more into that later. But a skilled nursing facility, your care is completely managed. Your meals are completely taken care of. Everything is done for you. You have round-the-clock nursing care, RNs, LPNs, a director of nursing, a chief medical operator. Everyone is there taking care of you. You're not allowed to leave the facility. Everything is done. Everything is managed.
Nice. So talk to us a little bit about the process. So how do you get from, okay, my mom or dad, maybe having some issues. I think they may need some assistance, but I'm not 100% sure. Like, what is the process from getting to that point, to getting to a facility or getting in care, home care?
A lot of times as people get older, they want to stay home, but also there are times they know they can't be at home, but they don't want to live with their children. And that's what a lot of people kind of miss too. They always think, oh, the kids just threw them in there. No. Parents and older individuals will sometimes say, I don't want to be at home, but I'm not living with my children. They want to mother over me and father over me and tell me what to do, but I still want a life. So for those residents, they'll have that conversation with their family members or their doctor, and they go in and the form is spelled out, sometimes called an MA51, like a medical evaluation and a documentation of medical need. Those forms will kind of set the doctor up and tell the doctor what they need to look at and to see what level of care you need. And so they might say, you know what, Mr. Jackson can take his own meds, he can give his insulin, he just shouldn't be alone around the clock. We're going to put him in assisted living. But then Mr. Jackson, on the other hand, could have a diabetic insulin that needs to be administered, but he can't see well enough to read the numbers on his machine to know how many doses of Lantus he should get at night. So he would need a personal care aide and a medication technician to do that for him. And he would go to personal care. Then you would have Mr. Jackson if he's had a multitude of falls, if he needs IV antibiotics, if he needs intense physical therapy, if he maybe has Alzheimer's or has dementia and needs to be in a locked unit to remain safe. He then will go to skilled nursing. Another big portion of deciding where your parent wants to go, unfortunately, or an individual that may be on their own, is the financial burden of long-term care. Within assisted living and personal care, you can pay for that out of your pocket. You can pay from Social Security benefits. You might even have a long-term insurance policy claim set up. With skilled nursing, you have to pay for that care with Medicaid or Medicare or other insurance. If you are someone that you're looking to place, or someone as your father may have a home, they might have to sell their home before they can qualify to receive Medicaid benefits to pay for their stay in a skilled nursing facility.
Wow.
Yeah, and we've seen that happen where people, they've lived in their homes for years, and their wife might still be able to live in the home, but in order to pay for their care, they have to sell that home. The wife has to leave, the wife has to move. She might have to go into care as well. The house has to be sold, and all of the money, all of their savings have to be exhausted to pay for their care. And care per month can run up to $9,000, which is $290 a day to take care of them. The house is gone. Their insurance policies sometimes have to be liquidated. Any savings, any assets, all have to be turned over to the facility to pay for that care. And then Medicaid kicks in. So oftentimes, a lot of people will decide, okay, I see that mom's having a decline. Let's get her in assisted living. Let's get her in personal care. Let's get all these things together. We'll sell the house, have these assets here, and let it pay for a lower level of care if they qualify for it. And then let them age in place before they make that final leap to skilled nursing. Because I mean, that's one of the most heartbreaking things to see, an older person maybe, or I guess not even an older person, younger people too, because we all have healthcare needs, have a stroke. And here they go, they have to get rid of everything they have in their bank account to take care of their care. And that's all their savings for their children, inheritance that they wanted to leave behind. It's now all being utilized by the skilled nursing facility to pay for care.
Wow, I had no idea.
Yeah, and that's why a lot of times you will see people, you're like, oh, why are they in this facility? They should be here, they should be there. And the reality is they're trying, and again, it's not always the kids that are money hungry. It's these parents that have worked so hard, or these individuals, these grandparents have worked so hard to build a life and to build something up that they want to pass on. And now, because maybe they fell and broke a hip, maybe they had a stroke, maybe something happened to them, and now they have to spend all that money on their care. And a lot of people don't know that. They just think, okay, well, I have insurance. Insurance will cover it, and it will, but you have to pay your part first.
Yes. And one of the challenges right now is that the deductibles are so high.
Yes.
And, you typically have to meet like a $13,000 deductible is what I have been seeing lately before insurance will even cover, pretty much anything. So it's crazy. It's crazy, and it's challenging, but it's also something that even though we are young, it's something that we need to be taken into consideration once we get old enough, or once we kind of go through something, maybe like an accident, like you mentioned earlier, you just never know what's going to happen that will cause you to need personal care assistance.
And you don't. And I mean, I've seen, so in personal care, you're able to get Social Security that will cover your rent. Because in personal care and assisted living, you basically pay rent. And in that rent, you're able to, again, like I said, Social Security, a VA benefit is something called aid and attendance. And so you pay maybe $1,700 a month. Maybe with Social Security, your Social Security could be $700. You get something called the personal care home allowance, at least in Pennsylvania, that boosts your care up to $1,295. Out of that $1,295, we give you $85 a month. So we're left with the remainder, which is about $1,210, $1,215, to cover all of your needs. We give you any soap, towels, washcloths, everything that you need. We cover your food. We cover everything except your medication copays and any outside things that you want to do. So out of that, we take care of you. If you have a VA benefit, which is again called aid and attendance, that's $1,794. We take care of you out of that. But if the rent's like $1,500, you still have money left over. So we're able to kind of do a little bit more with a little bit less than personal care because the overhead costs are not as high. You're not paying for a nurse's salary around the clock. You're paying for a personal care aide and a medication technician and a director of nursing services for just one part of the day. So you cut out a lot of overhead costs by coming into personal care if you are eligible for that.
Sorry. Are there any external resources that help people pay for personal home care assistance? Or is this just something that they just kind of got to figure out on their own with the help of their insurance companies?
Well, luckily, I know here in the state of Pennsylvania, the Commonwealth, we have something called a personal care home allowance. So if you have not worked, or if you haven't accrued enough hours into Social Security, and your Social Security is maybe only $500, no one can live off of that. Mm-hmm. No one. There's no way that you can feed yourself, clothe yourself, do all the things necessary to live off of $500. So as I stated before, there's the personal care home allowance that will boost your income up. And there are a lot of facilities that only take SSI residents. And they might, instead of having a private room, they'll have 4 to a room. And it's not because, they're lower paying individuals and we don't want to help them. It's because you have to do that in order to care for them. Again, could you imagine taking care of yourself off of $1,200 a month?
Not here.
Not here. So it's very difficult. And, a lot of times personal care homes and assisted livings, they get a bad rap because everyone is expecting that you're going to walk into this beautiful place because you're getting all this money and you have all this assistance from the state, and you don't. Mm-hmm. When the move was made to close down a lot of mental institutions and state hospitals, a lot of those people were put on the streets, and personal care homes and assisted livings took on the task of taking care of those people. But again, they took on that task at a low rate of pay. And it's very difficult to do that and to do it to the level that the state would like you to with such a low amount. So you end up having to pull in the SSI people and helping them get the benefit, but then you also need to reach out to the VA, and they have something called aid and attendance. Aid and attendance is for what you would call boots on the ground veterans, or veterans that were discharged from the Army and their disability might be 100% service connected. So they were hurt and they no longer can take care of themselves. Sometimes, especially with the Vietnam era vets, and there are a lot of them, and Korean War vets, their rate they can almost get $2,000 a month. So you try to bring in all those people kind of to balance out the services that you're able to offer. So those are the two main things that are offered right now. Other than that, and if you have a pension, we have a lot of our grandfathers and grandmas, they had these great jobs where pensions were available. Unfortunately for us in our generation, that's not as common, but they still maybe receive 5, 8, $1,000 a month from the railroad, and that aids in taking care of them as well.
Wow. Does that cover so veterans that suffer from PTSD, would that cover to give them assistance as well to get the help that they need?
Yes. So sometimes in personal care, you'll get facilities that want to charge by the line item. Now, my facility is a flat rate. You come, we're giving you cable, we're giving you a television, you're getting a bed, you're getting a powder room, you're getting a nice living quarters without an additional line by line fee. Your medication management is covered in that. Everything is covered. But you'll have maybe a high-end facility that's on a golf course, and every service that they offer comes at an additional cost. So maybe the rent there is just $2,000, but medication management per month is $1,000. Meals are another $1,500. Cable in the room, $200 a month.
Wow.
An aide to come and take care of you, another $1,000. So it's almost like concierge care, and you have to add on to it. And again, you think about a lot of these hardworking individuals that were maybe in a steel mill. They were bus drivers. They were these things that they might have the money to cover that slightly, but they don't have enough money to live the lives they will want to. So we just try to make things affordable here. Like we're a blue collar town. Like I said, most of my residents who are roofers and steelmen, and they worked at the phone company at AT&T. Like one of my residents, she was one of the first linemen. That's what she calls it. She said she was a lineman, but she was one of the first women that installed phone lines in people's homes in Pittsburgh, Pennsylvania. That's hard work. You're on your knees, you're on the ground, you're doing all those things all day. That's took a toll on your body, and she's suffering from it now. And while she does get a nice little pension from AT&T, or she called Bell Atlantic, it's not enough because they didn't expect these residents to live as long as they have. She's 88 and doing well, and she's going to be here for a long time. But that money at some point does run out. So we just try to get them there and to reach out and to teach them about savings and cut down on costs before they come into the home.
Yeah, we're actually looking into retiring in Turkey just for that specific reason. Because I think, my husband was telling me that over there you can live off of $300 US.
That's amazing.
You know what I mean? So, just think about that. You can just save your money or do whatever else you want to do with your additional money, that you get every month. But I do think that to a certain extent, we do get ripped off a bit in the States when it comes to how we use our retirements, just even down to the taxes on our land and all that stuff. So, but we're not going to get into all that.
I mean, there are people that even silently divorce once they hit a certain age, and their kids never know. And it's because maybe mom, she was diagnosed with early onset dementia or early onset Alzheimer's, and she knows she's going to have to be in the facility, but she doesn't want dad to not have the house. So they quietly divorce. And then when they get ready to do that 5-year Medicaid look back, they've been divorced 10 years. So that house only belongs to dad. So dad doesn't have to leave out the house.
Yeah.
And mom could go into the facility and Medicaid takes over the care. I mean, it's not fraudulent. But, but it's things that you have to know. And I would have never known that had I not fallen into this position. Because who would think that? I had some of my colleagues saying, oh yeah, as soon as their 50th wedding anniversary comes around, it's over. And I'm thinking, why? Who would do such a thing? And once they explained to me why, because they knew at some point, because the reality is a lot of people are not that healthy and they're going to need that care. They know, they may have been diagnosed with MS, and they know along the way, they're going to need more help. So why hinder my loved one with having to pay for everything and then have to leave the house? Let's just go ahead and do what we have to do for the inevitable.
Yes. And is there a time frame, like you were saying, that if the spouse is left behind or if they're still married, that they may have to sell the house? Is there a time frame from at the point that they are seeking uh, assistance from the time that they sell their house? Is there, like, you know how some people say maybe a 6-month time frame from this to that, or like, or is it just kind of whenever you sell your house and then you go through these steps, then you automatically get approved?
Right. So it all depends. Some people just go into skilled nursing for short-term care. You may have had a stroke and you just need some rehabilitation. You could have had a hip replacement. So you have up to, I think it's 180 days, 180 covered days in per year in a facility until Medicaid is like, hey, you got to pay up. You have to kind of help out with this. So you have time, like I said, to kind of figure some things out, maybe to transfer out of that facility into a personal care facility or something else before Medicaid is like, the government's like, hey, show me them pockets. That's basically what happens. I mean, you have to sign forms so they can go look in your bank accounts. They do something called a 5-year look back, and they look at everything you've done in that last 5 years. So if in year 4 you sold the house, not realizing this was going to happen, they want all that money from when you sold that house. If you have $250,000 sitting in your bank account, they want it. If you even sold the house to your children, they want it.
Wow.
If you turned it over to your children, they want it. So it kind of makes sense to kind of start preparing for that. If you have things that you know for sure that you want to pass down, it's good to start looking at that. It's awful, but it's not. We've had residents that were in personal care and they get to skilled nursing and they're like, I'm just going to stay here. I'm like, okay, that's fine. You can stay, but you have to sign over this paperwork so they can look back at your money so we can apply for Medicaid to cover your care. And I'm like, wait, what? Like, yeah, so you're going to have to liquidate this and liquidate that to pay for your care before your insurance kicks in. And they're like, nope, send me to physical therapy right now. I'm getting up. I'm getting out this bed. I'm coming back to personal care. I'm going to figure out what I need to do. And then when it's time for me to maybe move back, then I'll come back. Like once they realize that all their money is going to be gone, they're not okay with that. Because again, they work so hard for it and they don't want to lose out on that. And they at least want to have a say in where it goes.
Mm-hmm. Yeah, I completely understand that.
Yeah, it's a tough situation, but like I said, I don't intend to use it as a motivator, but I let them know what's going to happen. And I've had quite a few residents say, okay, yeah, let me start going to the bathroom on my own. Let me get active in my care because I'm not. And I've had one guy say this to me, I'm not going out like this. Let's go. and it's worked. I mean, and it's a good thing because it puts them back in charge of their care. And that's one of the big things about personal care too. Personal care allows a resident to be free. They're able to come and go as they please. I have a resident, he goes to what they call adult daycare at the VA, and he's been so upset because of COVID and he can't go. And he came down to my director of nursing and said, I need to go because I'm the DJ and they miss me. He's 88 and on a walker, but that's his life.
Yeah.
People think, oh, my parents are getting older. It's time for them to go. Like in my facility, young is 60. Because I have somebody who's 99 that wakes up every day, alert and oriented, cognizant with it. I'll say, hey, Mr. T, how you feeling today? Feeling with my hands, Shan. I'm feeling with my hands. These people are still very vibrant and they want the opportunity to live their life on their own terms. And, people don't realize the person that you are in your youth is the person who you're going to be when you're 80 and 90, if you're healthy enough and your mind is well enough to do that. We have people who are musicians. They still want to be musicians. I have a resident, he was a roofer. Can't work with his hands like that anymore. So he took up painting. So they want that freedom. And they also want to have the freedom sometimes to date. Maybe their husband passed away and their children can't stand the sight of them being with somebody else, but they still want that companionship. Mm-hmm. So they find someone there and they build relationships, they build new families, they build new friendships that maybe their children wouldn't understand.
Are there any red flags that a person should look for when looking for a personal care facility for their loved one?
Yes, absolutely. So I mean, because every place isn't for everyone, and
Right.
I've had to turn residents away. Again, I have more of what I would say a retirement care community. Again, there are people who have worked, or maybe they weren't able to work, but they, due to their mental health needs, they've kind of lived a very quiet, sheltered life. So they fit in. They fit in with the community. A lot of times you have people who are maybe in their 20s and 30s that need personal care. They wouldn't fit in with my community. We do wine nights, wine and painting nights, laid back activities that maybe someone 65 could do, but someone who's 35 who maybe had a stroke because they overdosed wouldn't do well there.
Mm-hmm.
You also have to see what the evacuation needs are. Um, I don't take people in wheelchairs from my facility, not because I have anything against, people with physical disabilities, but in order to evacuate my facility, you have to walk downstairs. And for anybody that has that type of care need that would have to like physically be lifted up and taken downstairs, I have to hire an additional person for that. That's an additional cost. It doesn't weigh itself out. So you want to ask, what kind of activities do you have? What's the basic age or the average age for your residents? What levels of care do you offer? Again, if it's your parent has more medical needs, you want to ask, is there a nurse on duty 24/7? Are there just med techs? Who does the training? What can you offer my mother? What can you offer my father? What can you offer my brother? And you also want to see what kind of neighborhood it's in. Because if, Uncle Joe likes to turn the bottle up and the alcohol in the wine and spirit store is in walking distance, and you can't keep in personal care homes are not allowed to lock people up, you might not want them there. So you also have to do your due diligence and see what the needs are of your loved one and see what can be offered there. And you always have to kind of go in and view the facility and you can't judge it based off of a lot of times the aesthetics. Because again, these people or these overheads and these corporations don't get a lot of money to take care of these residents. Look and see what the residents are doing. Are they just sitting around, not talking? Is it quiet? Is everybody shut off in the room? Or are they engaging? Or are they speaking to each other? Are they waving at you as you're walking by? Can you smell food? What does the environment actually look like? And is it something that your loved one would like? Not what you like, but your loved one.
Mm-hmm. And then there's also too the concern or misconception that if you put your parent or loved one into one of those facilities, that they're more likely to be abused or not taken care of, so.
Yeah, I mean, I think that people, are there horror stories and things that crazy that happen in nursing facilities? Absolutely. Have I been able to experience any of those things? Absolutely not. Thank God. Knock on wood. But I think that there's more good than bad. And it's mainly because you have these PCAs and these CNAs and these nurses that see your loved ones more than they see theirs. And they always say in a personal care home and nursing facilities, you're coming into someone's home to work. And that's what it is. This is their home. So you come to their home every day and it almost turns into your home. I have staff, I've been in the same position for 7 years. I have staff that have worked at the same position for 17 years. And it's because they love what they do. And they make sure that they take care of their residents. I mean, the jobs, especially during COVID, that I've seen CNAs and aides do are amazing. They bring clothes in. They do hair. They give the residents everything, literally the shirts off their back, to make sure that they're taken care of. And except even before COVID, that was a thing. I would see residents walking around in cash money, taking over the 99, 2000 shirts and everything else. And it's because maybe the family members weren't coming in or the resident didn't have any family, but these CNAs and these nurses and these aides take on and they love on their residents. But more importantly, we have licensing bodies that come in and make sure that we're doing what we have to do. We get surveyed annually, at least in personal care, but in skilled nursing facilities, you can get surveyed every month, every week. If somebody calls and makes a complaint, they take that serious and they come in and they will ask you why this happened, who it happened to, and what have you done to ensure that it doesn't happen again. We're not out here running around lawless. I mean, you have surveys, they can come in at 9 a.m. or 9 p.m. And when they have questions, you better be able to answer them. Anytime a resident in my facility is sent to the hospital, if they have a fall or an accident or anything of that sort, I have to report it to the state. And if they feel that it's a little bit malicious or it's a little bit tricky, they're coming in to investigate. They're going to ask me a few questions, but they're talking to all the residents and they're speaking to the resident that was hurt. Mm-hmm. Family members are also able to call those complaint lines and say, listen, I don't like this care. So we are monitored heavily and we have to answer for anything and everything that happens.
Well, that's good.
Oh yeah, it's good. It's good. I mean, it's a lot of extra work, but it's good.
So if you're out there watching, I hope you guys are taking notes and you know what questions to ask, you know what to look for in an awesome facility for your loved ones, you know what to do in reference to insurance. If you don't have insurance, if you have to sell your home, you know, just this is like, to me, it's amazing information because I had no idea about any of this. But my mom already told me I'm not putting her in a facility.
Well, a little background on me. My mother is a nurse. Everyone in my family, my niece Troby, Shy, Isaiah, Xavier, Manny, Kaylee, my brother Shane, everyone has worked in the facility. Everyone, and it starts with my mother. Because if you are a child of a nurse, especially a Black nurse, you've been to work with your mother. If something happens, you are going to work. You're going to work in the activities department on school breaks. You're going to work in the kitchen. You're going to work in laundry. You are going to learn how to earn $1.
Yeah.
Everyone there is going to teach you something. So everyone that works there, again, it's almost like a family depending on where you are, but everyone there is a trained professional. I have a master's in psychology. You know, you just can't walk in the street and say, hey, I want to be an administrator. No, you have to come with the education and the training. And just a little background. I am a double HBCU grad. I have a bachelor's from Johnson C. Smith University, a master's from North Carolina Central University, and I'm currently in a Doctor of Health Administration program at the Medical University of South Carolina. I had to have at least my bachelor's before I became a personal care home administrator. I had to take 2 weeks of training to get the license and prove that I was able to do this. And then I had to sit under someone before I was just put into the position. Even with licensed nursing home administrators, you have to have a bachelor's. And for most places, they want you to have a master's. And you go through a training that lasts, I think, 6 weeks. And then you have to take a national exam and a federal exam to make sure that you're able to follow the rules and the regulations. And then every year you have to go to trainings and get continuing education units. I believe for us, it is 18 in personal care to show that you're staying up to date on all of the things that you have to do and implement to be a good manager and a good administrator. So you are constantly inundated with things that you have to do to make sure you're working through and you're giving good care. It's not just something that I got my license, I'm working. No, you are doing something every month to make sure that you're up to date with the care that you're providing. So it's heavily regulated.
Which it should be, right?
It should be. And that's something else. Maybe I didn't mention it. When you're taking your loved one, see what type of staffing they have. If your person needs a lot of care, you don't want to go to a facility that only has med techs. So again, I'll break down that the staffing. So in personal cares, for the most part, you don't have to have a nurse. You should have a nurse. That's why I have Miss Denise Myers. My mother is a nurse. Hi, Mom. I know you aren't there. Because she can cover everyone. She can make changes. She knows what's going on. And she covers all the med techs. The med techs position, which is a medication technician, they go through about a 2-week training and they learn how to administer medications. So right route, right time, right resident, right route. And it's another one, right something. It's 5 R's. I should know them, but clearly I forgot. It's been a long day. And they administer medications, but they only administer medications that are prescribed by the physician. They don't make any changes. So they don't go in and fill Miss Thompson's head and say, oh, you have a fever. I'm going to give you some Tylenol. They never make that call. But if the nurse is there, she can say, you know what? I'm going to call Dr. Shipkovitz, see what he says. And then if he wants this done, I can write the order out and we'll administer that care. But that's done because, again, we have staff that know they have a person at a higher level of license that they can reach out to. And again, some facilities, they can't take on that overhead. So they only have the medication technicians. And that's safe. That's fine. But if you know that your mother needs a little bit more care and she's there for a medical need, you want to make sure that a nursing staff member is there to help with that. Med techs are great. A lot of times med techs, they learn this position and it's their first step going into LPN or RN school. Mm-hmm. So these are people that are already medically minded. They just haven't made the right steps yet to get the LPN or the RN designation or even a physician's assistant. And you also want to make sure that a physician is able to come in. Again, because I'm at a CCRC, we have to have a medical director for skilled nursing. The medical director, through conversation, decided that she was going to work with us as well. And I also called in other physicians so they had a choice in care. Because again, these residents aren't in jail. We can't make them do anything. They have a choice in care. So we offer 3 to 4 different doctors that they're able to see, and they pick one and they work with them from there.
That's awesome.
Yeah. And something else that happens, again, there's so many things that happen in personal care. Skilled nurse, if you go to skilled nursing or rehabilitation unit, you have physical therapy around the clock. That's maybe why you're there. In personal care, you don't have that. What you have is a home health agency that comes in and they do contract services for 6 weeks at a time. And these contract services can include an RN that is in direct communication with your doctor and can make any changes as needed. There'll be a physical therapist that comes in to help with straightening, leg strengthening, other cares, exercises, an occupational therapist that comes in to help you, maybe learn how to dress yourself again. They teach you how to get in the shower. They, help you with learning to comb your hair and working through the activities of daily living, which are ADLs, or IDLs, which are independent daily living activities. And then there will also be a CNA that maybe comes in and kind of help you out and get things back together. So that contract care will come in maybe after you've had a fall and you don't need to go back to skilled nursing, but we need to work on you not tripping over your feet. And maybe now, instead of walking independently, you get a wheeled walker. So they come in and help initiate those levels of care. And that's something good because, again, if your insurance bills and takes care of it, you don't have to pay anything for it. So you don't have to worry about paying out of pocket over in skilled nursing. Nice. So you want to make sure that those services are allowed in because, again, if you go to a concierge personal care, they may say, oh, we have physical therapy. But if you need it, you're going to pay us an additional $1,000 a month to cover that. And you can't pay it out of insurance. You have to pay it out of pocket, which is ridiculous, but it does happen.
Would they give you the option to go to an external physical therapy place so that they could use your insurance, or is that just kind of like you either take ours or that's it?
In skilled nursing, you take ours and that's it. In personal care, you do have that option because it's building your insurance. And I think like personal care really is like living in a senior citizen high rise or living on your own just with an aide. And something else that can happen too, if you can be in SNF, you can be in PC, you can decide, you know what, this is not it for me. I want to go home. That same home health agency can come to your house and offer you all of those services. During COVID, home health agencies, I believe, were very pivotal in keeping people alive because they could not stay in the hospital and they had to go home. And at home, they may have been able to get IVs run. There was someone monitoring their care. There was someone coming in and doing physical therapy, getting them up and moving around, getting those lungs activated, doing all the things that should have been done in the hospital, but unfortunately, there was no room for them in the hospital. And anytime you discharge from they call it a SNF, a skilled nursing facility, SNF, from a SNF or a PC, personal care home, you can ask for those services to be contracted out to you.
Nice.
I mean, the world of long-term care and extended healthcare services is amazing. And again, you don't think about them because for the most part, if you're a healthy individual, even if you're not, you don't know that you would need them. Right. But anyone with insurance can get home health. If you're in the hospital for 3 days or more, or 2 to 3 days, and you had a decline in your physicality, you can ask your doctor, hey, I need a physical therapist to come to the house. I can't go out to the gym and do this. I need someone to come in and help me. And it can be done. A lot of times people, and not to speak any negativity about people in the hospital, but a lot of times they're working, they're trying to get things done. There's a lot going on. They might not even think about offering you home care. And that's why we have to learn to advocate for ourselves and to ask for these things before, because again, you have residents who don't want to go home. They want to stay, they don't want to go to a personal care, they want to stay home. So if they want to stay home, you say, you know what, my mom needs home care. And sometimes with that home care, they'll see, oh, okay, I do need this. I need this every day. I need this around the clock. Maybe it is time for me to go to a facility, which we have to first learn to advocate for those services so we can help ourselves and we can help our loved ones.
Absolutely. So, Shannon, do you have any closing remarks that you would like to leave the viewers out there to kind of give them something to think about for the future?
Definitely. Placing your loved one, or maybe even yourself, if you had to make that decision for yourself, in a long-term living facility is not the worst thing in the world that can happen. It's not a horror story. It's not full of nurses and aides that are nurse ratchets or those things. You have social workers, one of the best social workers I ever worked with, Mr. Napo, that work with you to make sure that you have everything that you need, that advocate for you. Nurses, administrators, you have all these people that are there to make sure that your care is being given properly. As an administrator, my job is to make sure that I follow the rules and the regulations of the state. And then I'm blessed to have a great DON, Director of Nursing, that follows all those healthcare things. We are masters of our domain. And we make sure that we pass that information down to people so they can provide adequate care and excellent care, more than anything. So you have people that care for you. What I do, I never stop working. I'm at work no matter where I am. My residents can call me, the family members can call me. More often than not, you're going to have people that love you and want to do great things for you. Healthcare, again, is not one of those jobs you turn off and on. You're in it all the time. And you're in it not to win it for yourself, but to make sure that people have a great quality of life. Absolutely. So yeah, it's people care about you. People don't do this because honestly, it's not always a moneymaker. It's not about money. It really is about wanting to care for people and to see them live their best lives. Like I was talking about my CNAs that bring in their kids' old clothes. I've seen residents in wheelchairs pushing around in new Grippies and Jordans. And it's because their family members gave up on them. Mm-hmm. And they're there. So people are going to love on you. But on the other side of that too, you have to do your due diligence. Don't just go to a place because they have a golf course and they have this and they have that, because the care might not be nice. See who's working there. See what, the state has said about their care. See if they have a lot of bad, reviews, and because you can review people's annual surveys. See what their complaints are. See what it is that they can offer you. Like I said, my facility, we're going to dance. The kids are going to come in, to do trick-or-treating. You're going to have wine and cheese nights. We're going to go painting. We're going to do those things. That might not be sufficient for someone who has a severe mental health disorder and can't handle being in crowds. It's not a one-size-fits-all type of facility. So just do your due diligence, do your work, make sure your finances are in order, make sure your healthcare needs can be met, make sure your spiritual needs can be met, and make sure that you have peace of mind before you go anywhere.
Yes, ma'am. And for those of you that are watching right now, I want every single one of you to click like and share. I want you to share this information so that we can get it out into the community, so that our people know exactly what to look for in facilities, what to look for in their nurses and their doctors, and just to get their loved ones into a great place that they can feel comfortable that they're in the right hands. Shannon, just thank you again so much for blessing us with your presence on the show tonight.
Thank you.
To kind of hang tight, I want to also make an announcement. I also have a nonprofit. It's called Cairo Health Missions. You can visit cairohealthmissions.com, and we are hosting a scholarship. And so the scholarship is for Black or Hispanic high school seniors who are looking to pursue a career in healthcare here in Montgomery, Alabama. So one, if you know someone who is in Montgomery that is a high school senior, please visit the website so they can learn more about how to apply for the scholarship. But if you are watching and you would like to donate, even if it's $1 or $5, please just, go on the website. You can donate through PayPal or debit card. And we also have a Cash App, which is Cairo Health Missions. So definitely think about contributing to that. We would love to bless them with as much money as we can and help them with tuition, books, room and board, whatever the case may be that they need it for. But thank you guys for tuning in, and be sure to tune in every Monday night at 7 p.m. Central Standard Time. And Shannon, how can they follow you on social media?
So right now, because I'm in school and I'm still trying to find a job as Dr. Shannon, I know most of my information is private, but on LinkedIn, you can find me under Shannon Watson. If you have any questions, and if you can't find me, Dr. Gloria, if they reach out to you, I'll be more than willing to help them. This is a process, but I can help you depending on where you are, or at least put you in connection with anyone else. But also, I just want to encourage people too. This is a great career. Like I stated previously, my entire family has worked with me. A lot of people always say, get your own business. Don't work for anybody else. Working as an administrator and working as a healthcare administrator, anywhere in the higher ups, you have the opportunity to give jobs to people that look like you, that come from you, that are a part of you. And if nothing else, it's a different way to empower your community and give back to those that are treated less than. Everyone that's in my facility is treated like they are the kings and queens that they are, and it's because they are, but it's also because they paved the way for me and anyone that I employ. So look into healthcare. Like I said, look into administration, because there is so much that you can do. You don't always just give back by being a nurse or a doctor. You can give back by being a physical therapist, an occupational therapist, an administrator, any of those things. And so, like I said, if you have any questions about any careers or any guidance that you might need about placing a loved one or getting help with that VA benefit, if you reach out to Dr. Gloria, or like I said, find me on LinkedIn under Shannon Watson, I will be more than willing to assist with that.
Yes, absolutely. Well, thank you guys for tuning in tonight, and we will see you next Monday. Okay. Have a great night and good night.
Take care, everyone. Be blessed.